Welcome back to another episode of Cracking the Shell on Psychological Science. I'm Mike Doherty. I'm here with Joey Barnett and Arianna Gard, Professor of Psychology in the Department of Psychology here at Maryland. Welcome to the show, Arianna.
Hi, guys.
Hello.
So I'm really interested in learning about your work, specifically the work you're doing in D.C. So first, you just want to say maybe generally what do you do in your lab, and then we can get into the neighborhood study.
Yeah, so big picture, lab studies environmental effects on brain behavior and cognitive development in adolescence, but across the lifespan. And so in the lab, we have one very large project that we've been working on for 4 to 5 years now, which really has started with what community members want to know about their neighborhoods and their kids' brain development and behavioral development.
Okay, so we could take this in a number of different directions, but I'm really interested in sort of the practical implications of the work, but also maybe some theoretical stuff.
Sure.
So your work, as I understand it, correct me if I'm wrong, sort of links together sociocultural, economic, environmental variables to brain development, which is, kind of cool. Like, who thinks of the environment when they think of the brain? But you've been thinking about this link between the environment and the brain for quite some time. How did you get into this work?
Yeah, so, before I had the opportunity to come to Maryland, I was, really much of the literature thinking about how resources and inequality affects folks and kids' development, things about family level resources. So how much money your family has, your parents' education, and those are very important constructs that we care about in developmental science and in psychology. But parents and kids are also living in their own environments, right? And so if you are living in an area where you're not really supported, there aren't libraries close by, there aren't grocery stores close by, those factors are going to impact your own family's functioning. And so, from our folks over in the Perrin Mitchell building, the sociology building, folks have been thinking a lot about how the broader environmental context impacts families and individuals. Well, I would say that sociologists largely focus on how broader features impact systems, but psychologists are really interested in the individual. And so before I came to Maryland, I was thinking about how neighborhood resources, both economic, so the percentage of families in your neighborhood living below the poverty line, the average education levels of your neighborhood, some of the structural resources that are available in your neighborhoods impact the brain. And it turns out that, yes, family income and education are important for developing neural systems related to emotion and cognition, but also these broader neighborhood resources. And so the question is, well, why if kids spend so much time inside the home, right? And so some of the early work in this area has thought about, well, how do maybe parents explain this association between neighborhood resources and kids' outcomes?
I do have a question for you. So in human behavior is complex.
Sure.
Environmental factors are complex.
Sure.
How do you isolate or understand at the individual level some of those key variables you mentioned? And I'll just throw out a couple others, right? One might also argue or maybe hypothesize that environmental pollutants or noise or density might all sort of converge as factors that influence human development, behavior, brain, et cetera. So how do you isolate these?
Yeah, so that's really the key question, is much of these constructs these variables are really correlated with one another or, endogenous to one another. So neighborhood income levels are related to crime, are related to pollution, unfortunately, through all these things. And so I think that, when I came to Maryland, the idea was that, okay, well, what's the most important variable? We have researchers sitting behind our desk kind of using statistical models to decide, what's the strongest effect that predicts the brain. But instead, I think we should probably be asking folks themselves what they're most thinking about, what is most salient in their mind in terms of their neighborhood factors, right? And so that has led to the CARE project, which is the Community and Resilient Environments project, that really started with, okay, we know that there are lots of strengths, but also lots of risks in your environment. What are the things that you are most concerned about? And those factors are going to vary by person, but also by place and location. And so what we found in DC is that the two things that are most present in people's minds are community violence, as well as neighborhood change. And
But what do you mean by change?
Yeah, so colloquially, gentrification. So just new families moving in, pushing old families out. But why? And the key is that through qualitative interviews, through survey data, we have found that influx and outflux of people erodes or impairs social relationships between long existing neighbors. And so this idea that, we have our families take care of us, but we might have broader social safety nets that can step in if challenges arise in a neighborhood where you don't know anybody, or at worst, there's more hostile relationships between people. That safety net is gone. And so for a lot of Washingtonians, the concerns about newer, more well-resourced residents pushing older, more historical residents out is part of the concern, is that there's this erosion of this history and social ties and social fabric, where neighborhoods don't feel like a community anymore. They just feel like a place where people live. And so thinking about all these factors that you talked about, pollution, community violence, resources, number of libraries, grocery stores, all of those things, while they are all important, at least for the neighborhoods that we have been working in wards 4 and 5 of DC, violence, the experience of violence, and just this erosion of social ties, erosion of social relationships is really forefront at the mind. And there's going to be some individual differences in that, but those are the variables and the constructs that we're trying to isolate.
Very interesting. So I can't imagine you're going to answer this question overnight or in a year or 2 or 3. Where do you see this work going in the future? Well, first of all, I should ask, what have you found so far, either through your work or through work that you've read, and where do you see your work going in the future?
Yeah, so I think, again, something that we have found and others have found is that stronger knit communities where neighbors talk to each other more often, where there are more local community programming that brings people together, can really buffer against shocks or stressful insults to a neighborhood, even for families that have fewer resources.
So you oftentimes talk about resilience.
Mm-hmm.
So are you proposing some neighborhood resilience, community resilience?
Exactly. That there are place-based factors that promote resilience in families and individuals. And in part, that is through shared community programming and strong social ties.
Interesting.
So where we are hoping this goes is that we are hoping this goes to place-based interventions, meaning that, let's say mayor has $1 million to invest in something, right? If there are some neighborhoods that are really struggling with their social ties, really struggling with their social network, maybe there's programming that can be implemented in those specific neighborhoods to boost up that environmental resilience, community resilience, to help those communities. And indeed, those are some of the ideas, data-driven policy implementation that leaders in the district and elsewhere are really interested in. So how can we be more efficient with some of the funds for these area level policies? And the brain, I think where the brain comes in is the brain is really helpful for convincing people that things are interesting and worthwhile. So there are several studies now that have shown that communities that are tighter knit, folks have stronger neural function between empathy networks involved in the brain that support empathy and social processing, so that there are environmental effects on how folks process social stimuli. Mm-hmm. And in turn, that relates to mental health and well-being in a variety of areas, right?
Any relationship to kindness? Because
sure,
it seems like we need more of that.
Exactly, right? So, being able to, there's a long list of research that shows that volunteering and civic engagement and some of the studies of kidney donors, people donating kidneys to people who aren't even related to them, relates to more altruism and positive outcomes for folks. And so this is kind of part of that. But is there an ecological and neighborhood level resource that we can try to boost for that?
I do all lab studies. Pretty easy to do.
Yeah.
Community studies sound challenging. What are some of the unique challenges that you face in your work?
Yeah, I think that the biggest thing is that although this is my job to produce science. Community members have their own jobs and their own lives, right? And so fitting our work into folks' schedules can be hard. And so it's really easy to think, well, we don't actually need community input on this. It's all right. We're just going to keep going because we're on a timeline. But in many ways, you have to force yourself to slow down a little bit. And so the pace, I would say, of the work in my lab is much slower than other labs I've been in that haven't had to deal with scheduling differences and just life challenges that are brought by bringing, dozens of people together.
One other cool thing about your work that I'm just going to highlight, I know over the last couple of years you've been working quite directly with some of the community members. Some of the kids.
Yeah.
Tell us a little bit about what that's like.
So that's probably been the piece of the lab that has most engaged community leaders in buying into our work. If you're going to hire our kids to work in your lab and train them in research
How old
methods,
are they?
So these are 10 to 17.
Yeah. Okay. So they're getting a dose of science.
So they're really getting a dose of science there. So we did an internship program that was 85 hours long. Not only did they learn about kind of research and develop their own research questions, but we also taught them how to fill out a timesheet, right? Mm-hmm. So like some basic life skills that I think, caregivers really appreciated as well. But, folks have said, like, if you're going to hire our kids to work in your lab, yeah, we'll do it. We'll be involved.
What does it mean for the kids?
Yeah, so I think it has, several of the kids have now gone on to do internships at the Smithsonian, to do summer work. A couple of them are going to Brown this summer to go and take, classes at Brown, which is amazing. We've written recommendation letters for some of them, and, they don't need our recommendation letters. But, I'll tell you one story is one of the youth interns contacted me earlier this semester and said, Dr. Gard, I was wondering if you would like to collaborate on a project that I'm starting to, she's working on trying to gather a bunch of data on the number of families that are impacted by housing assistance in DC. I mean, this is like a 15-year-old.
That's
right?
amazing.
That's
really inspiring.
Would you like to collaborate with me? Of course, I would love to collaborate with you. So that's cool. I think that part of it is also just being a touch point for families and communities in this weird university setting, right? I mean, Maryland is not unique to other universities. Like, you walk onto a university campus, it's big, it's overwhelming.
It's intimidating, yes.
It's intimidating, right? And so, for some folks to be able to say, oh, I know the Gard Lab, like they'll help me figure out like what, how does admissions work? What's all that, that's really important. And so we've enjoyed that. What we are doing to make this more impactful is we've created a shorter series that's, instead of 85-hour internship long programs, we've created a shorter series that we're trying to deliver into schools. Right now we've delivered it into the YMCA, and so we go once a week for a month and talk about brain and memory and health and well-being, and we do little activities and just get kids excited about science, really.
Oh, this is so cool. I mean,
yeah.
I love this work. I love that you're out in the community, you're engaging the people in the community, and that your work is informed by the community.
Yeah.
It's such a wonderful research paradigm. Arianna,
yeah,
it's been great having you
It's been
on.
great being here. Thank you so much.
Thank you,
All
Dr.
right.
Gard.
Take
Thank you.
care. Bye-bye.